Good morning, my name is Austin Dindong and I was in a group with Nolan Christensen and Sarah Brookeman, and today we'd like to talk to you about a condition that we feel you might have, and that condition is known as whooping cough, and later we will run some diagnostic tests to ensure that, and I will explain that to you later. But first of all, I'd like to give you a little overview of what whooping cough is. It is also known as pertussis, is the medical name for it, but most of the population refers to it as whooping cough, and that is what it is well known by. And this is a highly contagious disease that affects the respiratory tract, specifically the lungs. And it is characterized by a severe hacking cough and a high-pitched whoop sound with inhalation. However, many people actually don't develop this symptom. And so that's kind of interesting, even though the name for it is whooping cough, and it affects infants, teens, and adults. So you as an adult, it is not uncommon for you to be dealing with this condition. And so symptoms generally don't begin to show until 7 days after initial infection. And based on the symptoms of what you've told us, you look like you've been in mostly the mild symptoms. However, one severe symptom we've noticed from you is your uncontrollable coughing. So we feel as if we've caught it fairly early on, and these symptoms are progressive and they will continue to get worse over time, especially in this next 1 to 2 weeks. But some mild symptoms that go along with whooping cough involve runny nose, nasal congestion, red, watery eyes, fever, and a cough. And then some severe symptoms that you will likely develop in the next coming days involve thickening mucus in airways, uncontrollable cough, as I mentioned, vomiting, and uncontrollable coughing kind of correlate and go hand in hand, as there's times that you may experience some uncontrollable coughing that may lead to you vomiting. And then extreme fatigue, face turning red or blue in color, and then a high-pitched whoop sound during inhalation. However, we haven't heard that from you yet. You may still develop it, but it is really not uncommon if you don't. Whooping cough is caused by a bacteria known as Bordetella pertussis, and this bacteria is highly contagious and spreads very easily through airborne transmission. And this bacteria gets into the respiratory tract and causes an infection, which has led you to experiencing the symptoms you are. And this occurs when an infected person coughs or sneezes. Droplets are then sprayed into the air and breathed into your lungs by those nearby. So you were likely exposed to someone who had whooping cough, and you breathed in some of the droplets that they expelled during a cough or a sneeze, and that has led to the bacteria getting into your body. Diagnosis: these are some tests that the doctor will order that we can ensure that this is the condition that you have, and then we can provide the best treatment options that are available. And so first of all, the doctor might order a swab test, and this involves inserting a Q-tip through the nose to collect mucus from the nasopharynx area. And this sample is then tested for traces of whooping cough bacteria. Another test that might be ordered would be a blood test, and this looks at your red blood cell and white blood cell counts in your blood. And if you have a high white blood cell count, that could be a high indication that you have an infection and inflammation going on throughout your body, as the white blood cells are trying to fight it and combat it. And then also a chest x-ray is another test that might be ordered by your doctor, and this would check for inflammation or excess fluid, as this is important to check the condition of lungs in case there is pneumonia, as pneumonia can be developed if whooping cough continues to progress and is not caught early enough. However, as I mentioned earlier, we feel that we've caught this early enough, so we feel that pneumonia is something that you will likely not develop. And so some treatment and lifestyle changes that are important for you to combat this whooping cough and to ensure these next couple days and weeks you're feeling as best as possible. We'll first get you on some antibiotics that will help your body continue to fight the bacteria and get that out of your system as soon as possible. Rest is another going to be a big thing for you, as it's important for you to give your body time and rest it needs to heal itself. And then important to drink plenty of water and get fluids in you and stay hydrated. And this is a big one too, eating smaller meals, as this can help you avoid vomiting after coughing. And try to keep yourself in as clean air as possible and keep free from any airborne irritants that may lead to more coughing spells. And then prevent transmission, isolate, wear a mask, wash hands frequently, and prevent the spread of bacteria from you to your family members. Then prognosis and follow-up, mainly depends on the severity and when treatment began, and it typically goes away on its own after bacteria has run its course through the body around 3 to 4 weeks. However, with the antibiotics that we've given you and the other lifestyle changes we'd like you to act upon, we feel that we can get this out sooner rather than later. And it's important for you to schedule a follow-up appointment with doctor if symptoms remain and progress, and as we don't want you developing pneumonia or having any other complications in the foreseeable future. If you have any other questions, feel free to ask me, but if you'd like to do your own research, Mayo Clinic and American Lung Association are great resources for you to look at and learn more about it. Thank you.